Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about kneecap or patella pain after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button if you're interested in all things related to knee replacement surgery, rehab, exercises, recovery, much more. So we're talking today about kneecap pain. So pain in the kneecap, in the front part or the anterior part of the knee. The kneecap, of course, also is your patella. All the same thing is basically pain and discomfort in the front part of the knee after knee replacement surgery. And unfortunately, this tends to be pretty prevalent. It's prevalent with folks who have their kneecap or the underside of their kneecap resurfaced as part of the knee replacement, as well as folks who don't have that, the kneecap resurfaced after surgery. So it's both of those folks. If you had that resurfacing or if you didn't have the resurfacing of your kneecap, it's still prevalent and can be common to have some anterior or front of the knee pain after surgery. So what causes this? There's a lot of different factors that possibly play a role. So first, we just look at the mechanics of your knee and your body and the alignment. So a lot of times a really common impairment is what we call a knock-knee deformity or a valgus deformity, and this is where your knee basically is not in a good alignment. It kind of comes in toward the middle of the body, the knocking of the knees together when you're walking or when you're standing up from a chair or squatting down. That knee tends to come inward in a knock-knee position or what we call a valgus deformity. And so this can be structural. It can be just the general makeup of the mechanics of your hip and your knee and the bones and everything. Or it can be a functional deformity, which means that you don't necessarily have this knock knee, this medialization of the knee, unless you do something that stresses the muscles in the body, such as squatting down, going upstairs, walking, things like that. So there's ways that we can kind of work on this with physical therapy, this misalignment, and a lot of it comes down to working on your coordination, working on your motor control, your mechanics, your alignment with different movements and activities. And I have some videos out there of different exercises that I like to do, but just as simple like sit to stands from a chair, doing body weight squats, doing step ups or step downs, lateral step ups, so step ups up to the side. A lot of these are basically you're just doing them and focusing on good alignment of the knee. Is the knee tracking, when you go down, does it stay in alignment with your foot or is it caving in toward the middle of your body? And can you adjust that with practice and with some cues, maybe looking at a mirror or having a manual cue from a therapist or something like that? Can you correct that? Another part of it is going to be just your strength in general. So we want to make sure we have adequate strength to provide stability at the knee and throughout the lower extremities. So having good strength in the quadricep muscles of your thigh, that's going to help provide stability of the kneecap itself and good tracking and good movement of the kneecap as you move and do activities. But also we want to focus on the muscles of your hip. So your glute muscles, your glute medius, your glute minimus, your glute maximus, and of course some other muscles around the hip as well to help provide that stability. So when you do stand up from a chair or you do perform a squat, you're not seeing this tilting of your pelvis. Your pelvis stays in a good position, your shoulders stay in a good position, your knee doesn't cave inward. Some other things to think about is making sure you have good control at the foot and the ankle. So sometimes people with a flat foot deformity where their foot is, they don't have a good arch, they have a flat arch and their foot might kind of rotate out to the side a little bit. This can lead to changes in the mechanics throughout the whole leg, at the knee and at the hip. So with good range of motion, good ability to bend the foot up toward your head as well as down toward the floor, and when it's on a firm surface, that's important as well, to having good mechanics and avoiding these issues of alignment with functional movements. And just other things to think about is that, these are the things that we can control, but there's also things that are going to be outside of our control that may contribute to this pain in the front part of the knee after surgery. So there's maybe some what we call mechanical errors, so things in terms of the size of the components of your knee replacement, the positioning, so there might be a little bit of rotation or positioning of alignment that may be off. There may be some issues with the positioning of your kneecap or your patella. It may be a little bit high or a little bit low, too much to one side. It may be tracking poorly. So the kneecap is this, what we call a sesamoid bone, and it's not really attached to any tendons directly. The patella tendon and the quadricep tendon, or the patella tendon, goes over the kneecap, but the kneecap isn't attached to anything, and it actually moves freely, and it helps provide this pulley system for the muscles of your thigh. But sometimes that movement of the kneecap is not in the right alignment, it's not tracking appropriately, is the term we like to use. And so that can be an issue of stability, and that may be something that you can correct functionally through strengthening and exercises, or it may be something that requires a surgical correction.